Hey guys, welcome back to the YouTube channel, and in today's video we're going to be talking about COVID-19 and its impacts on dentistry and any potential interview questions that you could be asked. Now obviously this is not to say that you absolutely will be asked this, however it is very good to be prepared. It is very much a hot topic in the world right now, and even if you aren't asked this, if you incorporate it into your answers, it makes you look like the better candidate. First and foremost, before I begin, remember it's really important to refer to coronavirus as not coronavirus, but COVID-19. Coronavirus is a branch of viruses, with COVID-19 being actually a subset of coronavirus. There's been coronaviruses before. COVID-19 specifically is what's caused a global pandemic, so it's very important to be aware of that. So refer to it as COVID-19. Secondly, I'm going to talk a bit about how dentistry has been impacted by COVID-19. Now, dentistry has been very heavily impacted by COVID-19. The first being patient anxiety. A lot more patients are now scared to come in. They're being expected to take their masks off, lay back and open their mouth to a stranger. That's obviously going to cause anxiety in anybody who is cautious enough already. Because of this increased patient anxiety, not as many patients have been actually coming in to the practice, which is a problem for, well, not only the patient and their oral health, but for us as well, because, well, we've had less patients to actually see. When I say us, not only do I mean dentists, but I mean us students as well. Currently at university, I'm hardly seeing any patients. Like, we actually have a session called triaging where we call up patients and ask if they want to be seen. Almost half of them are like, actually we're happy to wait if there's nothing urgent, and then that means we lose out on experience. The third one is a bit more important. There's increased PPE amongst practice, like a lot of increased PPE. Typically we'd wear the goggles and the mask, but now it's also become the visor, and the masks have been upgraded. So we have something called FFP3 masks. These are now being pushed out into practice. Obviously increased PPE also poses some problems. I've worn both and you can't hear anything that the other person is saying. Like, it is so difficult. On top of that, you're in practice, there's like a drill, especially for us dental students. We're on the floor with like 20 other students, and then there's like drills going on, people are talking, and like it poses some communication issues, definitely. And the last one, and actually the most important one that I would be familiar with, is this term called AGP. Now I actually referred to this in another video that I made, which you can, I don't really know how to do the whole YouTube, I'll figure it out, so either there or there or somewhere, which I'll link to in this video, which is generally my top 5 tips for dental interviews. AGPs are a term you should definitely be familiar with. Now, what does AGP stand for? It stands for an aerosol generating procedure. AGPs are any procedure in dentistry that produce aerosols, sprays, droplets into the air. The dental drill that we use actually sprays water out really quickly onto the drill to cool it down whilst it's drilling. Why is that a problem? Well, how is coronavirus transmitted? COVID-19. How is COVID-19 transmitted? It's transmitted through droplets. Now, if COVID-19 is transmitted through droplets, and I have a machine here essentially releasing droplets into the air, and if I'm doing a procedure that involves droplets being released into the air constantly, that's a bit of a problem. AGPs are a red flag in dentistry right now. That's where another term is introduced, something called fallow time. Fallow time is the stand down time between AGPs. So every time you do an AGP, you would essentially wait for a bit before you do another AGP. In this time, like, the practices are ventilated, things are cleaned out, and fallow time is really important to reduce the risk of COVID transmission. So know about those two, and if you're going to take away anything from this video, I will take away those two things, particularly AGPs. So that's how dentistry is impacted by COVID-19. Let's talk about the vaccines. There's 3 main vaccines which you should be familiar with. That's the Pfizer and BioNTech, the Oxford AstraZeneca one, and the Moderna vaccine. The government released a priority list in which who gets the vaccine first. Now, how it works is that the NHS will contact people in their due time when it's their turn to get the vaccine. And finally, be familiar with long COVID. Not too many people are familiar with long COVID. Now, what is long COVID? Long COVID is characterized by the remaining long-term symptoms of COVID-19 after an individual has recovered. I feel like I have that. My sense of smell is going and coming, going and coming. Just make sure to be familiar with the term long COVID, because not a lot of people do, so that you can talk about it. Right, that's COVID-19 and dentistry. I hope that was somewhat useful. If it was, do subscribe, because I'm going to make a lot more videos around, well, just everything that you could be asked in an interview. This is currently the hottest topic right now, so I thought I'd quickly get a video out there to help, well, whoever needs it. So make sure you do subscribe, and I will see you guys in the next one.